Our lockdown has been extended by 5 days. New Zealand's team of 5 million will have to wait until midnight next Monday, April 27th, before we move to alert level 3, where we will stay until at least May 11th. Prime Minister Jacinda Ardern made the announcement just after 4 o'clock today. She says whilst it won't make much of a difference socially, it will be a vital boost for businesses after the Anzac Day holiday, when 400,000 more people are expected to return to work. A big part of the decision to extend the lockdown is our ability to contact trace. New Zealand needs to be able to contact trace up to 1,000 cases of Covid-19 in case of a large outbreak in the next 2 years. That's among the recommendations in a new report into contact tracing by Dr Ayesha Verrall, who found as we went into lockdown, public health units were being overwhelmed by less than 100 cases a day. Dr Verrall joins me now on the phone. Good evening. Can you tell me what weaknesses did your audit uncover in our contact tracing?
So the main one was the scale that we're able to achieve because COVID-19 can cause outbreaks so quickly where the case numbers rise exponentially. The ability to achieve scale. Very good contact tracing occurs in public health units by the experienced professionals there. But they also need to be better supported by good data systems. And until we have that, we can't really have the assurance we need about the timeliness and the completeness of the process.
Okay, so you're saying there needs to be the ability to trace 1,000 cases a day within 5 days, is that right?
The time to trace a contact, they need to be traced within 3 days.
Right. So where are we at currently?
So I think I did the audit a week ago. The capacity had increased since the time we went into lockdown. I'm not sure by exactly how much, and it continues to increase all the time. I don't have an updated figure on the number of cases we can trace at the moment, but I think the scale of the government's announcement is in the right ballpark for achieving this target.
So at the time you did the audit, do you know on average how long it was taking them to trace people connected to a confirmed case?
No, and this audit was done over a day, but I guess, Lisa, the thing is, the trouble is I couldn't be told because that information doesn't reside in a single place in the system. We have 12 public health units. Each of them have a different data or information system for managing contacts. We have a single system for cases, but each of them had a different system for contacts. And the really good system that the Ministry had just developed for running their national hub service, that one hadn't yet been rolled out to the public health units. So we lacked a single system to be able to pull that sort of information out of.
So if we don't know that then, how can we say we've got a gold standard tracing system that allows us to move to level 3?
So at the moment, the way people get that information is by being in regular close contact between the Ministry and public health units of how issues are in the public health units, whether they're managing and whether they feel they're dealing with things in a timely way. And that's acceptable when we're dealing with a usual number of, say, tuberculosis or other communicable disease cases that we normally have. But obviously it's not up for the challenge posed by a large cluster of COVID cases or a small outbreak.
Are you comfortable with going to level 3 with the contact tracing system as it is?
Not as it is, but these improvements, I understand, are being made every day. The government appears to be putting a lot of resource into it, and I'm reassured they've accepted the recommendations in my report. So in that case, yes, I would be.
So they are moving towards it and having accepted your recommendations, but would be the ideal situation in your view to wait for them to implement those recommendations before we drop down a level rather than working to them while at level 3?
So I think that depends on a lot of other factors as well, like what the surveillance is telling you. And you'll see that in my report I say as a baseline we have to increase 3- or 4-fold and then also have the surge capacity to go up to 1,000. And given that level 3, at the time I wrote my report it wasn't clear what level 3 would look like. But level 3 also has quite a few restrictions in it, and the bubble size remains quite small for many people. So I think on that basis it does seem reasonable to continue the work that they're doing, and they have worked very, very fast to stand up this national service. So I find those things reassuring.
So the Health Minister has put out a press statement saying currently the National Close Contact Service has capacity to make 5,000 calls per day. Is that different to contact tracing 1,000 cases a day, making 5,000 calls?
Yes, it's different. That's right, because each case has multiple contacts. So if at the moment maybe our average bubble size is 5 people. So maybe right now, while we're at level 4, we could deal with 1,000 cases a day. But it's when we step down that we need that step down levels and our bubble size increases, so the number of contacts we all have increase. That's when you need that extra capacity in your system. So I see this system as what assures us that we can go to these lower levels with confidence to go about our business and go back to school and so on.
When we have more movement and before the lockdown happened, for every person with COVID-19, can you say on average how many people you have to trace when there is freer movement, like at, say, level 3 or level 2?
Yeah, so that's... I also don't have that data, but I think it was very difficult. Remember, we passed through those levels very quickly on the way to level 4 on the way up. And one of the issues was there were all these most of the cases were returning New Zealanders from overseas where COVID was more common. Many of them took domestic flights to travel around the country, and so that meant they had a lot of close contacts actually. So that was very challenging. I wouldn't be surprised if it was 20 or more close contacts. And sometimes for an individual case, the public health unit was taking a couple of days with several nurses working on it to trace one case.
So as it stands, the system as it stands, 100% obviously being top notch, how far are we away from that? What percentage are we at with our contact tracing service?
Well, I think the quality is high. It's the scalability that's the issue, and I suspect we're probably, as of a week ago, we're probably at about 30% of where we need to be. We've probably improved since I did my audit.
30% of where we need to be, and that does not worry you substantially?
To be resilient to an outbreak. To be resilient to an outbreak, yes. Yeah.
So you're talking about being prepared for the worst case scenario, in essence?
Not the worst case scenario, because we probably can't contact trace our way out of the situation that New York or London is in. But for an outbreak that can pop up in a week, we're about 30% of the way, or we were about 30% of the way there.
Appreciate your time this evening. That's Dr Ayesha Verrall, who did the audit on our contact tracing system.